Good morning, everybody, and welcome to our first web seminar. I predominantly work out of the London region as a lift consultant, also extending down into the southeast, and have been working at Dunbar for a number of years now. We put this pack together for our client base during this pandemic to give them some guidelines as to, what considerations are out there and innovations that are currently in the market or being produced by lift suppliers and manufacturers. So I'm just going to run through now this COVID-19 Reoccupation of Buildings pack that was issued, and obviously, as said at top end there, you will get a copy of this. We've split it obviously across 5 sections. The first section being COVID-19 risk assessment and what that means. Now, as I'm sure you are aware, the UK government has provided guidance to help employees and the self-employed to understand how to work safely during the COVID-19 pandemic. To help decide which actions to take, you need to carry out an appropriate COVID-19 risk assessment. As an employer, you have a legal responsibility to protect workers and others from risk to their health and safety. As an employer, you must do everything reasonably practical to minimise the risks, recognising that you cannot completely eliminate the risk of COVID-19 and future outbreaks. You must make sure that the risk assessment for your business addresses the risks of COVID-19, using the guidance to inform your decisions and control measures. Your risk assessment will help you decide whether you have done everything you need to. There are interactive tools available to support you from the Health and Safety Executive at www.hse.gov.uk/risk/assessment, which I'm sure you are familiar with. That neatly brings us into the considerations and managing that risk of COVID-19. Now, last week, I'm sure most of you would have seen more sectors opened up in the UK, and the HSE has called for businesses to make sure that they are COVID secure. Their inspectors are out inspecting and putting employees on the spot, checking that they are complying with health and safety law. Being COVID secure means being adaptable to the current guidance and putting measures in place to control the risk of coronavirus, to protect workers and others. Where social distancing guidelines cannot be followed in full, clients should consider what activity needs to continue for that business to operate. And if it does, what are the mitigating circumstances or risks that need to be done to ensure that can continue? These are steps we've put together for you to consider. Increase the frequency of hand washing and the surface cleaning of lift buttons, touch points and escalator handrails. Take all reasonable steps to help provide work from home where it is possible. Maintain 2 metre social distancing in the workplace whenever possible. Where people cannot be 2 metres apart, manage the transmission risk. Provision of hand sanitizer before and after lift escalator use and placed at strategic points. Check your floor areas of the lifts. Can social distancing be maintained? If you are looking to reduce the maximum occupancy of the lifts, consider communication to staff, signage, footprints. Now, our clients, a lot of them have put these already in place, and they are geared up for reoccupation come September, as some has laid out for their staff. Consider staggering arrival and departure times for your employees. This will help reduce crowding into and out of the workplace, and also, not ensure you've got multiple crowds of people on the landings waiting for lifts to take them to their destination. You could consider creating a one-way system using markings into the building. Staircases could be used for interfloor travel rather than taking the lifts. You could have one for ascending and one for descending. Social distancing is applicable to escalators too. So again, consider signage, and if it's possible to put signage on the escalators with graphics. Floors accessible by escalators should be used, lessening the requirements for lift use. But be mindful, you need to ask your employees and individuals with impaired mobility to determine whether they can safely take the stairs or the escalators. It could be seen as discrimination under the Equality Act not to give people this choice. I think when we talk about trying to encourage employees and staff to take stairs, often if you find, you know, people have all these smartphones now and smart watches monitoring and tracking how many steps they take. If you put signage up encouraging that, showing, you know, how many steps they will take by taking a certain number of flights or the calories burned, it does help in people taking, you know, the staircases rather than the lifts. Now, what can we do in terms of lifts themselves and the technology behind the lifts? Lifts with conventional landing and push buttons can be technically altered to ensure social distancing measures are enforced. Now, how we look to do that is in the next step. So, obviously, lifts have their load and have a load weighing device often on their lifts. This is normally set during commissioning with test weights loaded in the car. If your risk assessment obviously is identifying that you wish to reduce the capacity of these lifts, you could technically alter the load weighter to only allow one person or two people, or whatever number of persons your risk assessment permits, to ensure those lifts operate only with those number of people. There is an overload function on lifts. This allows car doors to remain open when the lift car is overloaded. Again, by calibrating that load weighter, should people neglect the risk assessments and procedures put in place, the lift will not move until that person or persons have removed themselves from the car. There is a bypass function. This allows the lifts to bypass any landing when the lift has its maximum capacity that is set in the cars. This will obviously not allow people to be collected en route, obviously increasing the number of people in the lifts. With destination control systems, which is typically large groups of lifts, these assign passengers with the same destination to the same lift cars. To minimise the number of stops the lifts will make during the journey, in this way, destination control systems optimises the lift system capacity. Destination control systems can be programmed to not exceed the number of passengers under the social distancing rules or your risk assessments that you have laid out. TÜV SÜD Dunbar Boardman can model your lift system operation to assist in determining achievable social distancing occupancy levels. Now, we have done that with a number of our clients, and we have done some traffic studies and traffic analysis for large buildings and large groups of lifts. This has enabled building owners, building managers to assess staggering, shift patterns for their buildings, because there's a realisation there's going to be large volumes of queues potentially of people if they all come back at one time. And we can help you with the raw data to get that correct for your building. Moving on to section 3, recommissioning of lifts and escalators. Now, during this pandemic, especially in the hospitality sector, there's been a lot of buildings completely vacated or closed because the government hasn't advised that they can open yet, in particular gyms. So many lifts have obviously been left static for some time. And we must be mindful what this means when we start to reoccupy buildings. Whilst most will go back into service without any issue, there are some precautionary steps that should be taken before returning them to regular service. Be aware, mindful, if the LOLA certificate is out of date, then the lift must not be used. There are no extensions to the deadlines under LOLA due to coronavirus. Hydraulic lifts, they may have sunk onto the buffers due to internal valve leakage over time. It has been switched off. Ropes, chains, cables. These are items installed on lifts and escalators which are designed to be in regular rotation operation. If they have been left stationary for long periods of time, this may have resulted in unnatural wear to sections of the rope or chain. Batteries. Lifts use many volt batteries which supply emergency equipment including auto dialers, hand winding systems, emergency lighting. If the lifts have been isolated for long periods of time, this may have caused the battery to discharge, not be capable of operating. Escalators do not come under LOLA, but after a period of being out of service, they may need their drive and step chains lubricating again. And we're going to sort of touch on now LOLA, or lift equipment and lifting operation regulations, and what that means. The Lifting Operations and Lifting Equipment Regulations 1998, or LOLA for short, identify the requirements for the safe provision and use of lifting equipment. Regulation 9 of LOLA requires that all lifts provided for use in work activities are thoroughly examined by a competent person. But what is a competent person, or a thorough examination? A thorough examination is a systematic and detailed examination of the lift and all of its associated equipment by a competent person. Typically, that competent person is separate to the maintenance provider that you have maintaining your lifts. This provides you with a thorough examination separate to the maintenance provider, giving you a detailed report of any safety implications that need to be rectified by your maintenance provider. These regulations place duties on people and companies who own, operate, or have control over lifting equipment, from service and platform lifts all the way through to passenger and goods lifts. TÜV SÜD can provide an independent, periodic, thorough examination for your passenger, goods, service, platform, and mobility access equipment. We've actually been quite fortunate, if you like, where some of the incumbent LOLA inspectors have been concentrating on hospitals and places of high risk. Some of our clients have unfortunately had to reach out to us where we have helped and carry out a LOLA examination so that their lift equipment did not have to be isolated. We are, nationwide. We have multiple offices nationwide, so we are very flexible and being able to carry out LOLA examinations with competent staff, members of staff, to assist clients, as we have shown over the COVID-19 pandemic. Which actually brings us to the end of our webinar in essence. Section 5 is LOLA questions and answers. So I think we've probably gone through that very quickly in all honesty. So if there are any questions, then please feel free to submit, and we'll happily answer them in the time left.
Okay, thank you very much for that, Phil. Ladies and gentlemen, if you want to submit your questions just now, if you just give us a couple of minutes, we'll just sort of pull some of the questions up. So Phil, I don't know if there's any questions there that you want to fill up.
Yeah, no, very good question there. Yes, if your LOLA or thorough examination has expired, you should remove that lift from service, and it should be isolated by a competent person. As we said during this webinar, escalators are not subject to LOLA, but should have thorough examinations carried out. If you are currently in contract with Dunbar Ballman, then I would advise you to seek and speak to your consultant to discuss what defects are outstanding and what can be put in place to get them rectified as soon as possible. Okay, so another good question. Dunbar Ballman, we have multiple maintenance contracts with clients across the UK, and within those maintenance contracts, we monitor and chase LOLA closeouts. So we chase the LOLA thorough examination, which has a list of defects. And we chase the maintenance contractor to ensure that they are closed out in a timely manner. And it may be within our maintenance contract that there are KPI, key performance indicator penalties for these maintenance providers should they not meet the deadlines set out in the contract. So that's how we manage LOLAs for our clients. It's typically monthly meetings, or it could be spread over quarterly meetings where we discuss all manner of things, including loaders, with the client as well as the maintenance provider. Any other questions?
Phil, one's come through to me, if I can just read this out to you.
Yep.
On a practical level, how realistic is it to socially distance in a lift? Has the government made any special allowances?
No, there are no government allowances in place currently. They have left the risk to the building owners and the building managers. And again, we revert back to the risk assessment and how we mitigate the risks for people using lifts. As we've seen in the transportation industry, on trains and public transport, they have insisted that masks are worn every time you take transportation. I would suggest the same is applied to lifts. Should you be having more than one person in a lift, as an example. But again, if you've got larger lift cars, you can probably allow 2 persons getting the social distancing. Again, that's something we can assist clients with in terms of traffic analysis and measurements of lift cars to provide you that raw data to help you with your risk assessment.
Okay, Phil, is there any others that have come through to you just now?
Just having a quick look. Nothing that I've seen as yet. Oh, actually, there's one there. Yes, there are many new innovations out there on the market which will help you in terms of COVID-19. There are many hygiene cleaning products now out on the market. I've seen push buttons which are hygienically clean, if you like, so bacteria cannot manifest on the buttons. So that's an interesting product. There are new products for enabling phones to be used, so that you don't have to use push buttons to call the lifts. You would, or can, with some applications, use Bluetooth to call the lift from your phone. With destination control systems, I know there are future developments, again, to have an app on your phone and be able to call the lifts from the landings within the building. Obviously, there will be restrictions on this and it will be managed by the building management team. But there are many innovations out there which we are and have been helping our client base assess whether they need to have them in place. But of course, there's lots of clients now looking ahead at future-proofing their building and looking at budgets for bringing some of these innovations into their buildings, for future outbreaks. Because let's be honest, I'm not entirely sure we're going to be completely over this. I think there will be future outbreaks and possibly newer strains, if you like, such as COVID-19. But again, if you have any queries on any quotations and things of that nature, we are in constant communication with suppliers as well as contractors, so we can guide you as best as possible what would be the best solution for you, and obviously give you an idea of rough costs where we can.
And I think just to add to Phil's response there, part of TÜV SÜD, as you know, we are a global provider, and we can offer hygiene audits as well. So as well as you doing your additional cleaning in your buildings, we can actually send our business assurance unit in to do hygiene audits, take swab samples to see if you are COVID-free. That is something else that we can offer. So again, if you'd like any more details on that, just please ask myself or Phil at the end of this, and we'll get some information out to you on that.
Phil, there's another question that's come through here. Is there anything that can be done to enhance the ventilation rate to the car without side air?
There are some products out there currently which can be put in the lift cars. Air filtration units, I believe, has been developed. Again, that's a new innovation. How well they work, I've not seen personally as yet, but it would be interesting to explore that. So yes, there are products out there now for that specific requirement. There's also another innovation that's been brought out, which is UV lighting in lift cars. UV lighting has been proven, I believe, by WHO that it can eradicate or deteriorate the COVID-19 strain. So there's also another product out there for lift cars, as well as going on to escalator handrails. The handrail passes through the device, which is emitting a UV light stroke beam onto the handrail to sort of clear up and eradicate any bacteria strains of COVID-19.